Hi, it's Dr. Ruth the Pain Doc, founder of Chronic Pain Rescue, an online telehealth practice dedicated to helping people who suffer from chronic pain. I am so excited today. We have a special guest. She is Dr. Carola Okogbaa. She is a board certified ophthalmologist who practices in Louisiana. She specializes in the medical and surgical treatment of eye diseases. She is also founder of Louisiana Center For Eyes, a comprehensive eye clinic that helps individuals reach their best vision and maintain a healthy eyesight. She received her degree in biology at the University of South Florida in Tampa, Florida. She went on to complete her medical degree at Creighton University School of Medicine in Omaha, Nebraska. And then she completed her ophthalmology residency at Tulane University School of Medicine. Dr. Okogbaa lives in Baton Rouge with her husband and her 3 wonderful children. So welcome. Thank you so much for joining us today.
Yes, thank you, Dr. Ruth, for having me on. I really appreciate it, and I'm looking forward to our conversation today.
Yeah, great. Well, you know what? I have to say, out of all the specialties, I bow to ophthalmologists. I really do, because the fact is, when you write notes, the rest of us have to have someone explain to us what it says. So I know it's a specialty above. The eye is so important, and there's so much to it. How did you choose that specialty? How did you decide to become an ophthalmologist?
Wow. Well, that's a story behind that. I didn't know that's what I was gonna get into when I went to medical school. But you're right. The eye is like it's own little world. At the same time, I have to let people know that it's an actual organ.
Right.
It's an organ in the body. And
Right.
so we got to take care of our eyes the same way we are mindful of our heart and other organs. Yes, the eyes are very important. And so, yeah, so in med school, my intention, I've always kind of knew I wanted to be a doctor. I think since I was younger, I love helping people in that health space, so I've always been drawn to that. And I love the sciences. I love biology. So it was kind of just natural for me. And I just wasn't sure what I was going to do. I just thought I was going to be the doctor who helped deliver babies. Really, I thought I was just gonna. I've always saw like the miracle of birth as something unexplainable, and just the whole process. And I was excited about that. But when I got to medical school, in learning about all these different systems and organs and all of that, my interest kind of widened. And so then how you go through that process of, okay, what do I like, what do I don't like, what do I really see myself doing, what I don't see myself doing. And I was really blessed to have a mentor who was actually an ophthalmologist, and I started working with her quite a bit. And my first exposure really to the world of ophthalmology was through her. She was really passionate about what she does. Not only was she faculty, but she was really involved in the community, and she would do glaucoma screenings at churches and health fairs. And I thought, wow, that's incredible. And was literally finding things like glaucoma, things that could cause blindness. And that just piqued my interest. And I had already been interested in surgery, and I found out, well, it is a surgical specialty as well. And so I my path kind of kept leading me there. And so I made it there. So now that's what I do. I take care of the eyes.
Awesome. And you do great work. I mean, that's really commendable. Now, are you originally from the Louisiana area? Just a question. I'm being nosy.
No, actually, yeah. So I am originally from the Caribbean. I am from Haiti originally. I grew up in Florida, and then went all the way to Nebraska. So I'm tropical, and I went to the cold, right, for med school, and then eventually made my way south, and I'm in Louisiana. So
yes. All I know, I can tell you, I've never been to Baton Rouge, but Louisiana, New Orleans, the best food in the country. If you
Yes.
don't know where good food is, you got to go to Louisiana. That's just it.
Absolutely.
That's
I
just
agree. I agree. Yes, we love food down here in the Big Easy. So
yes, yes, yes. So I really wanted, my specialty is chronic pain. So there's a lot of causes of eye pain. In fact, being here in California, I guess this is for my own, health. Both my mom and I have a lot of eye pain just because the air is so dry here,
Mhm.
and you get burning. And so anyway, I just figured it would be a good idea to ask you about common causes of eye pain. I think many times we neglect taking care of our eyes. I know, how often should people be taking care, going sure they're seeing their eye doctor, to getting those screenings, and then if you have eye pain, what are some things that might be the cause of that? Those are two different questions, but anyway.
Yeah, yeah. I think that the eyes is the most neglected part of the body, but until something goes wrong, right?
Right, right.
Until my vision's not clear, until I don't know why I cannot see that sign. I don't know why I
Right.
cannot see that book in front of me, until I get a fiber in my eyes and now my world is falling apart, kind of thing. So the eyes they're strong and yet they're delicate, and again, people tend to not take care of them until something goes wrong, that they cannot see to function. And so what I tell people is, just like you have your annual or every 2 years you get everything else check your eyes out, right? Don't neglect just your annual eye examinations. And so
Mhm.
even for kids, we recommend get their eyes checked, because sometimes children, they cannot tell you that they cannot see out of one eye. And I'm
Right.
so grateful that our colleagues in the pediatrics world are really, really good at that, screening for vision, like vision
Mhm.
screening. Even the schools are helping with that. And
Right.
so, because that that also plays into their learning and focusing and all that functional things that we do. Our vision is important, so we
Mhm.
like to catch it even from childhood. And then as
Right.
as as we get older, it still should be, you still need to get your baseline exams. um, we recommend that, especially at the age of every few years, every 2 3 years, in your 20s and so on. And then the eyes start to change in our 40s. Now we can't see close up, right?
Mhm. Mhm.
So
Mhm.
presbyopia, we call it, hits. And
Mhm.
so then and that's when we really emphasize, get those annual eye exams, or really every 2 years at least get your eyes examined, because that's when we look for conditions and diseases and things start showing up
Right.
that you may not even know. But the eyes is really the window to a
Mhm.
lot.
Right.
So even your
Right.
general health, sometimes we'll pick things up. I'm like, wait, what's going on?
Right.
I need to
Very true. Very
let's
true.
get
That
primary care
diabetes.
doctor for that. Or, oh, we see something. Yeah. And you have no idea, because it's not messing with your vision. And
Mhm.
so just making these one of your eye exam, put that on your checklist of your health checks, I
Right.
say. And then as we age, in the 50s, we start getting early cataracts start to develop. And then it's like, just put it every year, the same way you get put your annual eye exam on your calendar. Okay, get it
Makes sense.
done, so okay, I got that checked off of my list.
Right. Right.
So even if you
Are
don't,
there? Hmm?
yeah, I was gonna say, like, even if you don't like it, when we're young, we don't really think about our eyes. Uh, but whenever, just put that on your list of, okay, the doctor did say I need to check on this, and just get it done. At least get a baseline exam. You know.
Right, right. I understand. Are there some things you should be concerned about, maybe genetically, or if things are in your family that you're at risk for certain things with eyes? Just wondering about that.
Yeah, yes, absolutely. Well, the biggest thing is we have systemic conditions, very common systemic conditions that can impact the eyes profoundly. Number one, diabetes, right? So the minute someone is diagnosed with, especially with type 2 diabetes, the next step is you got to get an eye exam, because it could have been impacting your eyes and you don't know it. So diabetics are encouraged to get their eyes at least once a year. They have to get an annual exam, because it can be silently messing with your eyes.
And what about pre-diabetics? Because some people, they're not quite diabetic,
I say everybody, because people in that I have, people come in, the doctor say I'm pre-diabetic. I don't fit. I said, well, good. You're getting your eye examined. So then it gives me a chance to also, it just presents an opportunity, right? To get the eyes examined, look for other things. And the other thing is like glaucoma, which is a big one, which can, set in at any age, really. And so, and if you have a family history, it's important that you get your eyes examined, whether you think you have anything going on or not. So so those, and then something called macular degeneration, and various things.
That one sounds very scary, the macular degeneration. What do people have to worry about? Is that like up and coming, or is just that we're just hearing about it these last several years? It's growing? It's
been around. I think people are just being more educated about that, because it's a leading cause of vision loss in people age 50 and older. So it's like you have your glaucoma and you have macular degeneration right next to it, right? And diabetic retinopathy next to that. So we have some of these things to the point where we had, like, this is the month of February. It's dedicated as Macular Degeneration Awareness Month nationally. So people can be aware that, there's a condition out there that can cause you to lose sight. And so very important, like everything else, the sooner we catch it, the more we can have a game plan and help you through that journey.
Right. Are there ways to, when you make those interventions, can you do more than just slow it down? Are there things to do to maybe reverse things when it comes to eye disease?
It depends. It depends. For example, glaucoma is, we cannot cure glaucoma. We cannot make it go away completely. Once you have that diagnosis, you have it. But we can work with you to the point you don't have to go blind with that condition.
Okay.
Right. So we can work with you. There's different treatments, there's things like that, follow-ups, but the sooner we get it, the better we can do with keeping your eyesight.
Now, is glaucoma painful? If someone has eye pain,
it can be. That's one of the conditions that I would list on the possible causes of eye pain, but it's not the most common type of glaucoma. Most glaucoma, which is what we call open angle glaucoma, the most common type here in the States, it's typically painless. You don't know you have it. It impacts your peripheral vision, and usually by the time you realize you start having symptoms, it's actually you're advancing stage in the condition.
Okay.
However, there's a category called angle closure glaucoma, where the pressure, when the fluid is flowing out, it gets trapped and it closes. The angle or that door closes and fluid cannot flow properly through the eye, and the pressure in the eye skyrockets, and that can present. So when somebody come to the ER with severe eye pain, quick onset, all of that, that's the number one thing on your differential, acute angle glaucoma, right? Is
that something that has to be emergently, like?
Because it can really take the vision out very quickly.
Okay.
It's not the most common cause of eye pain, but it is a significant it's a significant issue if you do.
And what are some other causes of eye pain? And what to do?
So with eye pain, interestingly, anything can cause pain to the eye, right? Because the eyes, what I love about the eyes is that it'll always tell you something's not right. And it has a lot of nerve endings, right? And so you can feel if something from a foreign body, you get an eyelash in your eye and your eyes will tell you. And it's because it has so much nerve endings that it's programmed to kind of let you know so that you can pay attention to it quickly. Right? So that if you have something like a bacterial conjunctivitis or something like that, or an eye infection, then it just takes your attention away from everything else, right to your eyes. Say, okay, something's not right. I'm feeling pain. And so then that would lead you to go seek help, because there's certain things with the eyes that can progress really quickly and cause blindness, such as an ulcer on your cornea, right?
Yeah.
Or something like the pressure being so high. So it's like, wait a minute, what's going on? Or if you have a foreign body in the eye, so those are the eye has its own system to let us know that something's not right, that we need to pay attention and seek help for it. And so inflammation, anything that can cause inflammation nowadays, well, we'll talk a little bit more about that, but any kind of conjunctivitis, foreign body, any injury, have a corneal abrasion or a scratch, that hurts like crazy, right? And so that people go to the emergency room, very painful. But you need to take care of it right away, because if it get infected, you can lose your eye pretty quickly too. If you get if you get an ulcer. And what else? Anything pressing on the eye, pressure, any type of injury. And then you have things like, just for chronic, chronic, that you get this little discomfort all the time. One of the biggest things these days is dry eyes.
Right? Yep. I'm waiting to talk about that. Tell me what to do.
Dry eyes and allergy eyes, our environment and how we are using our eyes. Sometimes lack of sleep, right? We get that painful discomfort. Like, why is my eye hurting? Well, you haven't rested for 3 days.
Right.
So
or even maybe being too many hours in front of the screen.
That's exactly one of the reasons why we're seeing so much dry eyes. And in kids too, like, because we're using our digital devices so much and for so long. I always say, most people, you get in bed, every organ, every part of your body is getting rest except for your eyes, right? Because you're right here with the phone. You're saying you're resting, but you're not resting the eyes.
Right.
So that's one of the things that can cause chronic, that constant little irritation, little pain. Or one of the big ones, like the quick sharp pains. It comes for a few seconds, it goes. It comes for a few seconds.
Yeah. What is that? Is that from dry eyes?
Yes, ma'am.
Well, thank you for diagnosing me. Yes.
And then you have, and then of course, usually you have other symptoms, like for allergy eyes, even with dry eyes, you get the itching, watery eyes, red eyes. So sometimes there's associated symptoms with what's going on. Or if you have internal inflammation, like we call iritis or uveitis, that's inflammation inside of the eye. The eyes can be really, really painful, sensitive to light. You barely can open it. And then, infections, some, people who have shingles, right on that side of that forehead. It could, if the eye is involved, it could be painful. And so anything really can cause pain to the eyes. Some things can cause chronic chronic pain, but the whole point of pain is for the eyes is to really get you to go and look further into what's going on with your eye.
Yeah, go and find out what's going on. What's the cause?
And then the more you ignore it, the more frequently it comes.
Yep. It's funny that you're talking about this. That I just put out. It's on my social media stuff. Your body's talking to you. Are you listening?
That's so true. That
Yeah,
is
so
good.
very
So
good.
yeah, so
All
eye
right. Well,
pain is a
thank you
big
so
thing for
much.
sure.
Hmm. I'm sorry, what were you saying?
Yeah, I was saying, eye pain is a really, it's a huge sign to kind of push you to go and take care of your eyes, find out what's going on, and so that you can work with your doctor, your ophthalmologist, primary care doctor, just so you could, so that they can lead you to, okay, so what's causing it? Is it a condition? Is it an injury? Is it something that you're
Mhm,
doing? Is something that you're not doing? At least it
mhm.
leads you somewhere to a next step to take for your eyes.
Right. One more,
Mm.
well, I have a couple questions. What about, I've heard of these, I guess, glasses that people wear for blue screen. I don't know if they're
Mhm.
blue or, but they say to wear these glasses if you're on a computer a lot to help protect your eyes. Are you familiar with that? And does that help?
Yeah, so the whole concept is blue light. Okay.
Blue light.
So we know blue light is emitted in the atmosphere, and what it does, it reduces production of melatonin in your body. That's what blue light does,
Mm-hmm.
right? So all of these devices we use, they emit a certain degree of that blue light, right? So these glasses you're talking about, they call them blue light filters, or you put them on your computer or on your eyes. It's not necessarily the blue light, and there's been research that's
Mm-hmm.
been going on about whether or not that really impacts the eyes themselves. So they find out that it's really not, um it doesn't is the blue light is not really causing the damage to the eye itself. But
Mm-hmm.
what blue light mess with is your circadian rhythm,
Mm-hmm.
because it reduces your melatonin, because you're constantly being exposed to it. So it reduces your ability. So it mess with your sleep quality.
I see. I see. I
The
got it.
problem with the computer is more the glare. You get the dry eyes, the we call it digital eye syndrome, just because you're overusing your eyes. It's not producing enough tears. It's eye strain. So it's
Mm-hmm.
not helping you with the strain. The strain is you spending too much time on the digital
Well,
devices,
right,
not
right.
the
Oh
light
my gosh.
coming from the computer.
Yeah.
But if you,
Necessary evil.
yes, so I think sometimes people kind of get that wrong. Of course,
Mhm.
maybe it may help. I don't know, but no research has really
I
identified that it's
see.
a cause of damage to the eye,
Itself. I see.
but
I
it
see.
can impact your sleep quality, because
Right.
it affects your circadian rhythm and give you poor sleep quality. Well, guess what? Poor sleep quality is gonna also mess with your eyes then.
Yes,
So it's like a
yes.
cycle.
Mhm. I see.
Yeah,
I
yeah,
see. And just so I use a refresh. My mom
mhm.
uses her
Artificial tears.
little
Yeah,
artificial tears. She was told to use warm compresses, so she got a
yes.
little electronic one to make it a little faster for her. I don't know. Is there anything else you can do for dry eyes? I'm just just before I let you
Yes,
go.
again, dry is big. A huge part of my practice is managing dry eyes, because our eyes get dry. One age, right? Because we start
Mhm,
losing the glands that make tears.
mhm.
That has the internal system that keeps the eye lubricated. We
Right.
start to lose that because when we are on the computer so much, we lose something called our blink reflex. We're not blinking as much as we should over
Oh,
time, right? So
okay.
the science behind that is over time, because we're not blinking, the
Mhm,
glands stop functioning the way we should, and therefore we
mhm.
lose them, and therefore they don't make enough tears to keep the eye lubricated, right? So that's
Okay.
one thing. And then you have your environmental factors about not sleeping enough, and that impacts the eyes. Then with
Mhm,
age, you get the you know, hormonal things that happen, right?
mhm, mhm. Right,
Menopause and all of that. That also
right.
causes the eyes to get dry. Not just
Mhm.
being dehydrated, not drinking enough
Not drinking
water
enough water,
causes the eye
right.
to be dry. So it's like sometimes it's just a combination of things.
Absolutely.
contributing to why the vision is not why the eye is dry. And so we
Right.
have to address many things to
Mhm.
help stabilize the to help stabilize dry eyes. Sometimes we have to put people on drops. We have to do all the other treatments in addition to the artificial tears.
I see.
And then you have environmental things, not having the fan on and getting
Mhm.
enough sleep.
Mhm.
Working on
Mhm.
4 hours, your eyes are gonna be dry. They're not gonna be happy.
Right, right.
So.
This has been so good. Thank you. Thank you for my free advice for me and my mom.
You're welcome, but definitely go see the eye doctor, and they can kind of,
Yes,
how bad is this dry eyes, and what are you doing, and how can we partner with you to kind of help maintain those eyes? Because
absolutely.
in the world that we live in, we are using our eyes a lot, so we want
Yes.
to keep them healthy so that they can keep working for us.
Absolutely,
Yep.
absolutely. And with that, how can people in Louisiana reach you if they're looking for an eye doctor?
Yeah, so you can go to my website, Louisiana Center for Eyes, www.LA Center, or check us out on the social media platforms like Facebook at LA Center for Eyes, and Instagram at LA Center for Eyes, and YouTube at LA Center for
Okay,
Eyes. So I'm kind of everywhere.
very
Or,
good.
down south, just come on by, right? Make it come
Okay,
on
all
by
right.
the office, make an
Well,
appointment.
yeah, thank you so much, Dr. Okogbaa. This has been very informative. People, reach out, let her know if you need her. I hope if you got anything from this, write in the comment. It would be helpful to know that. Okay. All right. Until next time, peace and blessings. Thank you.
All right. Thank you so much for having me.
All right.